अस्सलाम वालेकुम, इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में एसके सीरीज़ का सर्जरी का जो 25 में मॉर्निंग का पेपर है वो मैं डिस्कस करने जा रहा हूँ। तो वो चलें स्टार्ट करते हैं। क्वेश्चन नंबर 1, 4 नंबर arteries arise from which of the following, that is aorta. Question number 2, the Addison disease patient present with which feature, that is beta hyperkalemia. Question number 3, in Graves' disease exophthalmos is due to the deposition of the glucosaminoGlycan. Question number 4, most common chromosomal abnormality is the Down syndrome. Fifth, heart works as a syncytium because of the gap junction. Sixth, middle carpal bone in the proximal row is beta, that is the lunate. Next, 7, after trauma on anatomical snuff box, patient having the bleed and the pain due to which structure damage, that is the radial artery. 8, opioids act on beta mu receptors agonist. 9, the tragus and the anti-helix is derived from the beta first pharyngeal arch. Question number 10, loss of innervation of the foot nerve involved will be the tibial nerve. Question number 11, a patient whose cuboid bone crushes by a run-over accident by the light vehicle, which muscle will be affected? The tibialis posterior. 12, cavernous sinus infection because palsy of the lateral rectus nerve injured will be the abducent nerve. 13, the patient came with epigastric pain, heartburn on endoscopy. Perforation of the first part of duodenum was seen. Which artery is eroding the duodenal ulcer? That is beta gastroduodenal artery. Next, 14, anterior to the left suprarenal gland is beta, that is the Lazar sac. Next, 15, which of the following structure lies deep to and the parallel with the carotid sheath, that is Charlie's sympathetic chain. 16, which of the following act by the phospholipase beta oxytocin. 17, which one of the following directly control the autonomic reflex system of the body? Hypothalamus. 18, aortic valve open during which phase of the cardiac cycle? Charlie, rapid ejection phase. 17, the pansystolic murmur is associated with the mitral regurgitation. Next, 20, an old patient presents with a large prostate and there is the marked increase in the PSA up to 20, having the weight loss MRI done and the bone mets observed. What is the route of spread of prostate carcinoma to the vertebra? That is the vertebral venous plexus. Next, 21, the patient had RTA. He does not know recent events but he remembers his school events. Where is the lesion? That is the hippocampus. 22, referred pain from the ureteric colic is felt in thigh due to involvement of the following nerve, that is delta, the genitofemoral nerve. 23, in Alzheimer's disease involve area of the brain, that is the entorhinal cortex. Next, 24, G6PD associated with the D favism. 25, child with the multiple transfusions failure to thrive, having a large spleen, hematocrit 12% is likely suffering from a thalassemia major. 26, the patient having the chronic gastritis develop ulcer due to Charlie H. pylori. Next, 27, a patient loss of proprioception occurs after RTA. What is the underlying mechanism? The beta lateral inhibition. 28, the patient having the tremors while starting some movement. In this coordination, he is having lesion in beta, that is cerebellum. 29, an athlete who got an injection to delay menstruation at 14th day of cycle. What was that injection? That was the progesterone. 30, source of estrogen and progesterone in the first trimester is the corpus luteum. 31, the skin damage. Which layer of the skin will first regenerate? That is the stratum basale. 32, rectum blood supply from the IMA. 33, the footballer had a hard blow on the lateral side of the knee. The structure likely damaged is Charlie medial collateral ligament. 34, the Barrett esophagus leads to which of the following? Alpha adenocarcinoma. Next, 35, a 30-year-old male presented with a history of the fever, weight loss, painful micturition, hematuриas in the flank mass. His HP is 18. What could be the possible pathology associated with his condition? That is alpha, the renal cell carcinoma. Next, 36, the paraneoplastic syndrome occurs in alpha small cell carcinoma of the lung. 37, the patient of the chronic hep C with increased ALT AST. The cause of increased ALT AST is the hepatocyte membrane damage. 38, the 40-year-old male with the jaundice liver function test shows direct bilirubin 10, ALP 1000, ALT 75, GGT 2 to 7. What is the most likely diagnosis? That is the extrahepatic cholestasis. 39, the great saphenous vein graft taken from the anterior to the medium malleolus. Supporting cells of the pars nervosa includes the beta, that is the pituitary. Next, 41, which of the following test to be done for the typhoid fever during the first week. There is a mnemonic BASU and it is blood culture. Next 42, the giant cell type in the TB is the delta Langerhans. Next 43, goblet cells convert into the Clara cells at the D, that is the terminal bronchioles. 44, the terminal bronchioles contain A, the Clara cells. 45, Clark nucleus level, that is beta T1L3. Next 46, the pus that accumulates in the boils or abscess is mainly composed of the neutrophils. 47, the type 3 HS occur in the SLE, that is hypersensitivity. 48, in the TB helper T cells are involved in which type of reaction, that is Charlie type 4 hypersensitivity reaction. 49, the skeletal muscle calcium binds to the calciquestrin. 50, the deficiency in which of the following cause the hyperexcitability, that is the Charlie the calcium. 51, IgE present on which the mast cells. 52, submucosal fibrosis is, that is Charlie, which is the pre-malignant condition. 53, the patient had an RTA and had injury to the spine and developed quadriplegia. Respiration BP were normal. After 3 months, he came with the blood pressure that fluctuates and raises high 180 by 110 and told that the BP gets lowered when lower abdomen and the bladder area is massaged and after passing urine. What is the cause of increased BP? That is increased sensitivity to the catecholamines because of upregulation of the alpha receptors. 54, 512 Hz tuning fork placed over the head of the patient. Receptors involved would be the Pacinian. Next 55, 18-year-old student visits her physician for a routine physical examination. She has no complaint. Physical examination is unremarkable except for the mid-systolic click followed by the late systolic murmur heard at the lower left sternal border and the apex. The murmur duration increase in the standing and shortens with the squatting. ECG shows no abnormality, which is the following is the most likely diagnosis, that is the mitral valve prolapse. 56, a man lifted heavy weight, sudden pain in the arm on examination, swelling in the upper forearm of the muscle which is attached to the radial tuberosity, that is the bicep brachii. 157, the patient having MI left circumflex artery infarction, area involved would be the left atrium and the ventricle. 58, the child playing jungle line game, he got goosebumps. What is the mechanism? That is beta constriction of the rectus pili muscle. 59, the aortic hiatus in the diaphragm, structure passing through it is the thoracic duct and the azygous veins. Next 60, injury to the greater wing of the sphenoid and the inferior orbital figure damages which nerve? That is Charlie the zygomatic. 61, the beta and the T lymphocytes necessary for the normal immunity. The primary sites of their maturation are the Charlie, the thymus and the bone marrow. 62, the person with the difficulty in the swelling, there was some white growth inside esophagus with a pseudo hyphae. Likely reason is alpha, that is the candidiasis. 63, which of the following is detected by the peripheral chemoreceptors? Alpha, the decreased partial pressure of oxygen. 64, the necrosis will have Charlie, the dystrophic calcification. 65, woman test positive for the CA125, it is tumor marker of ovarian carcinoma, definitely a delta. 66, when fibrinogen is converted into fibrin by thrombin fragments released in the plasma or the fibropeptide A. Next 67, activated peptides release E, thrombostatin and the serotonin. 68, the right atrium infarction involved which of the following? That is Charlie, the pectinate muscle. 69, mother Rh positive, father is Rh negative, mother conceive Rh negative baby. How? That is Charlie, Rh antigen will link into the mother's circulation. 70, the mean in large sample is delta, represent the normal distribution. Next 71, 61-year-old female presents with the hypertension, increasing weight, which of the following features would be most suggestive of the Cushing syndrome rather than the simple opacity, that is alpha abdominis trias. 72, a 10-year-old boy diagnosed with the tinea solium infestation, the drug of choice would be the niclosamide. 73, the technique used to detect abnormality in the microdeletion the chromosome is the delta, that is FISH. 74, the patient undergoes gastrectomy, develops macrocytic anemia, the treatment should be injection of the vitamin B12. 75, antibiotic for the Bacteroides fragilis would be the clindamycin. 76, the droplet infection can spread up to alpha 1 to 2 feet. 77, the droplet infection can spread up to 1 to 2 feet. 78, the time taken by the ethylene oxide gas to sterilize would be 2 to 4 hours. 79, soon after excitation there will be the coupling of beta cross linkage of the actin and the myosin 80. The patient has given injection penicillin, after which he develops shortness of breath, bronchoconstriction. What should be immediate drug to be given? That is definitely IM adrenaline. He is having an anaphylactic shock here basically. Next 81, the patient brought to ER unconscious, there is breathing problem, empty bottle of aspirin found. How antidote will act the increased tubular excretion of the aspirin. 82, patient found unconscious near the empty bottle of aspirin. Antidote will be given, that is bicarbs. Diet in the patient with the type 1 hyperlipidemia is decreased intake of the cholesterol and saturated fats. 84, drug which has more clearance than the inulin will be Charlie, that is the filtered and secreted. 85, the true about thin loop of the Henle is the alpha flattened base. 86, the stagnant hypoxia occur in the Charlie, that is the polycythemia. Next, 87, the true about thermoreceptors, that is Charlie large receptive field. 88, which lymphoid organ has the paracrine action, that is alpha thymus. 89, 17-year-old boy is brought to the hospital in an altered sensorium. He is taking slowly shallow breaths and his breath has a fruity smell. On ABGPA 7.2, urinary ketones positive, which is the most likely cause, that is a DKA. 90, patient has the frequently irregular pulse. ECG shows the P waves, no P waves, and many abrupt RR waves. Many abrupt R waves, and the QRS complex shows irregularity. That is definitely AFib because of no P waves. 91, the metabolic acidosis is caused by the fall in the bicarbonate. Next, 92, the trypsin act on which amino acid, that is alpha, which is the terminal carboxylic group amino acid. Next, 93, the crescents in the glomeruli are found due to the proliferation of delta parietal cells. 94, an obese patient wears a tight collar shirt and feels tightness in the collar and the faint whenever he turns his head. Which of the following is responsible for this? That is beta, increased venous compliance. Next, 95, the Hering-Breuer reflex will lead to the inhibition of alpha dorsal neuron of the central respiration. Next, 96, the inspiratory RAM signals are produced from dorsal respiratory neurons. Their rate increase in response to impulses from beta, the pneumataxic center in the pons. 97, the patient with the severe headache, vomiting, and the neck stiffness raise ICP on the lumbar puncture. There is blood stand CSF, that is delta subarachnoid hemorrhage. 98 is the following is elevated in the nasal polyps, that is the eosinophils. 99, the patient took his hand forearm to scratch the back muscles but unable to fold arm and scratch the back of the body. Muscle involved would be the latissimus dorsi. 100, a 58-year-old male presented 10 days after the coronary artery bypass surgery with the purpura. Blood test revealed platelet count of 35,000, PT 11, APTT 24. Second, the normal red cell morphologies. Most likely cause of the purpura is Charlie, the drug-induced thrombocytopenia. Next, 101, a 20 years old young boy presented the fever, headache, vomiting. He is having neck stiffness and altered mental status with hallucinations. Which among the following is the brain-eating parasite? That is definitely alpha Naegleria fowleri. Next, 102, a woman after RTA was brought to the emergency where she was intubated and was transfused blood. After a few days, her HB got down from 12 to 8 on endoscopy. Gastritis and the gastric ulcer were found, which is the reason behind the gastritis. There is a bicarb in the chloride shift. Next, 103, the 12-year-old child having the fever, throat body cause will be the staph pyogenes. 104, a student of the final year MBBS witnessing surgery for the first time, collapse in the aorta due to the decrease in the peripheral resistance. 105, the final common pathway is beta, that is alpha motor neuron. 106, on direct light in the right eye pupil dilates and the left constricts. Which is that? That is Charlie, the right relative afferent pupillary defect. Next, 107, the structure damage during the hysterectomy during the ligation of the uterine artery at the lower level of the ischial spine would be delta, that is ureter. 108, the person running in the marathon, blood flow to the non-exercising muscle is by the sympathetic cholinergic. Next, 109, most common site of metastasis tumor in the brain is the beta cerebral cortex. 110, location of the superior parathyroid gland is the beta posterior to the recurrent laryngeal nerve, cranial to inferior thyroid artery. 111, the patient cannot utter words due to the damage of beta, that is the Broca's area. Right and left lobe of the liver is divided by the Charlie middle hepatic vein. Next, 113, which artery block cause the infarct at the apex of the heart, that is the beta anterior interventricular artery. Next, 114, the first line macrophages of the defense in the lungs is beta, that is the dust cell. 115, the patient cannot abduct and adduct his fingers due to the damage of which of the following nerves, that is alpha ulnar nerve. Next, 116, the gas gangrene cause death due to Charlie, that is septicemia. 117, the woman with the history of the trauma to the head and neck region having the lesion in the tongue on the protruding of tongue deviated to the left side, the nerve most likely injured, that is the alpha option. Next, 118, the anterior surface of the heart is formed by the beta right ventricle. 119, the patient presented with the pain in the right hypochondrium, nausea, and the jaundice pain is going to the shoulder region and the upper back. Which condition is associated? That is the D, that is the cholecystitis. Next, 120, in galactosemia, the defect is in, that is alpha. Next, 121, which of the following is a pain mediator after the knife injury? That is Charlie, the prostaglandin. 122, difference between the spleen and the lymph node is the beta splenic sinusoids. 123, the mechanism of the cancer formation is Charlie, initiator followed by the promoter causing the carcinomas. 124, the patient presented the headache. Next, given as photophobia on LP, glucose is 40, raised neutrophils. What is the diagnosis? Is pyogenic meningitis. 125, artery present at the base of the pyramids is alpha, that is arcuate artery. Next, 126, edema in the kidney related disease in the patient is due to the beta, that is hypoalbuminemias. 127, the patient is having the bleeding disorders. Lab shows PT14, APPT 60, and the bleeding time 6 minutes, and the defect in which of the following pathway? There is a beta intrinsic pathway. Next, 128, the patient presented with epistaxis, BT14, APTT 60, and the PT15, pH normal. This diagnosis is Charlie, that is von Willebrand disease. 129, max aortic pressure in which phase of the cardiac cycle? That is delta, rapid ejection phase. 130, a patient after RTA having 8% blood loss in 30 minutes with no change in the RTA pressure. Which of the following has the maximum loss of the blood? That is the vein. 131, which of the following is the autosomal dominant disorder? That is Charlie, FAP. 132, the patient presents with the chorea, mental retardation, depression, and the memory lapse. The mode of inheritance of this disease is E, that is autosomal dominant. A pregnant lady of the 12 weeks gestational amenorrhea presented with the flank pain, rigors and chills, high grade fever. This is due to beta acute pyelonephritis. 134, the patient has the malaise and fatigue, has decreased TLC, platelets, basophils, neutrophils, all cell line decrease. By which of the following will not decrease? The Charlie, the T lymphocytes in strangulation, which one will be damaged? That is delta hyoid bone. 136, which of the following is important for the malignancy? That is alpha infusion. Next, 137, most common risk of the giving steroids to the diabetic patient is Charlie, the D-range glycemic control. 138, the patient with obstructive azoospermia may have raised, that is Charlie IgG. 139, the smoker and the psychiatric patient is having treatment presented with the pain, abdomen, and the visible peristalsis and the audible sounds on the examination. Diagnosis will be Charlie, the pyloric stenosis. 140, the 25 years old male with the complaints of the shortness of breath. X-ray shows a large shadow in the chest. On echo, it was related to the right ventricle of the heart containing hemorrhagic and the necrotic area. There is alpha rhabdomyosarcoma. 141, there is a small cystic mass in the left atrium with the involvement of heart. It is the feature of the alpha, that is the myxoma. Next, 142, important finding at the angle of Lois is delta opening of azygous vein into the SVC. 143, in RTA damage to shoulder joint at the lower border of the first tib will likely damage which artery? That is the beta subclavian artery. 144, Redmond syndrome is definitely the vancomycin. 145, the mechanism of action of the insulin is the increase in the potassium inside the cells. Megaloblastic anemia feature is beta, that is oval macrophages. Next, 147, cyclosporine act by stopping T cell differentiation. Next, I cannot read this one properly. 149, the Parkinsonism effect. Which of these? That is beta substantia nigra. 150, the histology of the macula densa is delta deep basal lamina. 151, hypercalcemia leads to which effect on the heart? Alpha systolic arrest. Next, 152, the child was brought to an OPD with episodes of bleeding and ecchymosis, but his lab are as follows. The diagnosis would be the platelet function defect. 153, suspicion of arm in the its supination of arm is done by which muscle besides supinator? That is delta bicep brachii. 154, the functional remnant of mesonephric duct in the male is the ductus deferens. 155, after hemorrhage Ag binds with which of these? That is beta, the heptoglobin. 156, an issue of patient U waves are there. Basically the U wave are linked with the hypokalemia. Next, 157, which condition is related to the eosinophilia? That must be Charlie, asthma. In treatment of SAH, which CCB can be used? The nifedipine. Sorry, it is nimodipine. It is delta nimodipine. Can be used. 159, a 8-month-old boy is brought for the assessment. He was born to an HIV infected mother. The most liable investigation to confirm HIV infection in this infant would be HIV RNA detection by the PCR. 160, the patient having the traveler's diarrhea not responding to antidiarrheals. Which drug must be given? That is Charlie norfloxacin. 161, a pathologist see a slide that the neutrophils are utilizing oxygen burst oxygen reaction was seen in which step it is necessary the beta microbacterial activity the neutrophils. 162, patient after artery sacral region of the spinal cord damage has which effect? That is E, the neurogenic bladder. Next 163, the trypsin acts on which amino acid? That is alpha terminal carboxylic group amino acid. 164, so the following decreased triglyceride level by the decrease in availability of the fatty acid, that is beta gemfibrozil. 165, which of the following collagen laid on collagen in the bone formation? That is the Charlie, the fibroblast. 166, renal part which run from the renal cortex to medulla between the renal column is the beta renal pyramid. 167, a muscle that is attached to more than one joint and prevents the excessive movement of the proximal joint is called as the fixator. Next 168, the winding seen in the cardiac tamponade is the pulses paradoxus beta. Patient has the chest pain having the cardiac problem from 1 year now have opening snap mid diastolic murmur. It is the characteristic of the mitral stenosis. 170, the normally physiological function of the placenta is alpha prevent methionine and the fetal blood mixing. 171, the characteristic of the glycogen storage diseases delta hepatomegaly and the hypoglycemia. 172, what happened in the whooping cough? That is Charlie hyperplasia of the respiratory bronchus. 173, cranial and the spinal nerve both supply beta, the motor supply the muscles. 174, in TB helper T cells are involved in which type of the reaction? That is Charlie type 4 hypersensitivity reaction. So thank you for watching my video. Do subscribe my channel. Till my next video. Allah Hafiz.